Hello and welcome to NCQA's annual HOQ Users Training Review. I'm Michelle Taylor, one of NCQA's HEDIS account managers, and I'm going to be your guide through this demonstration. Healthcare Organization Questionnaire, the HOQ. What is it? Well, it's a web-based questionnaire where organization, plan contact, and product line, which would include the enrollment and state licensure, information is collected. It's used to request submission IDs that are required to report HEDIS data to NCQA. Your submission IDs will be made available in the IDSS in April when it's released. Also, demographic and performance data that are collected in HOQ and IDSS are used for all of NCQA products. So that would be your quality compass, state of healthcare quality, and the health plan ratings. Okay, 2019 data collection timeline. For those that need the complete timeline, we have a link that will take you to the web page so that you can see that. But for now, we're just going to go through for a few of our, I guess, hot deets. Of course, in January, we did release the HOQ. And from release until we actually close the HOQ, we'll be going through the approval process. We do want to mention that January 31st is the CAPS and QHP validations deadline to get those completed. Our deadline again is February the 15th, and there has been a change to the time that you need to mark final by. No longer midnight, but 8 p.m. Eastern Standard Time. Everything has to be completed and marked final. In March, we will be sending out a customer satisfaction survey for HOQ. Please take a little time and give us your feedback. We do value your feedback and we do use it to see if we can make improvements to the system. So we really would appreciate it if you just take a couple minutes to complete the survey in March. In April, we will be releasing IDSS. And then we've added in May where we do our enrollment verification outreach. That's where we might have some questions in regards to the enrollment for the states that were listed in the HOQ. And we're trying to get those things straightened out before we do HPR. So if you get an email from any of our data collection staff with asking about information for your state enrollment for your plans, please respond to that as soon as possible. We do have some deadlines attached to that, so we just want to mention that that happens in May. Of course, in June, we do have a date for where your plan lock must be applied, and that's June the 3rd. And this year, the deadlines for all submissions and all products is June the 17th, and you have until 11:59 Eastern Standard Time to get that done. So what's new for 2019? Well, we don't have a lot, but we have a few things. Medicaid only submissions for LTSS, the long-term services and support submissions. They can now be requested in the HOQ under the special project menu. And of course, during the demonstration, I'll show you how to do that. For the NCQA accredited plans, all NCQA accredited plans, there must be a submission complete HEDIS submission for accreditation. What that means is there has to be a submission that includes the total accredited population. So you may have other submissions that would be used for the state or for CMS. That's fine. You would still request those. But there has to be one submission that is just for accreditation that includes your total population that you have accreditation for. If you have any questions on that, please contact your assigned HEDIS account manager and we will be happy to help you with that. We made some clarifications in the HOQ and I'll show you that, and it's for the accreditation enrollment reported under the product section, and then for the marketplace terminology that we use for required reporting, there's some additions there, and so we'll go over that during the demonstration. Okay, new submissions and clarifications. So our new submissions, LTSS submissions, and basically all of those submissions will be brand new because the LTSS submissions will only contain the LTSS measures. So what we have here is a snapshot of what it looks like in the HOQ. And basically, if you're submitting LTSS data, you're going to create a new submission. So you would go to your product line, as of course it's going to be Medicaid. You're going to put in your reporting product, and then you're going to go down to the special project. In that drop box, you would select LTSS. Once you do that, your submission type is going to automatically change to other and gray out so that you can't make any changes there. And then for special area, you would leave that as none. Of course, when we go through the demonstration, I will show you what this looks like and how to do that. So moving on to our accreditation enrollment clarification. This also is a snapshot from HOQ, but we just wanted to point out a few things. There's some differences if you're accredited versus not accredited and how you're going to enter your enrollment information. If you're not accredited, you're going to only select the states that your organization is licensed to operate in. And then if you have members that are located in non-licensed states, you're going to take those enrollment numbers and include them in the state that you are licensed to operate in. For example, using the DC metropolitan area. Say I was only, DC metropolitan area generally is a tri-state area, which includes DC, Maryland, and Virginia. So if you say I'm only licensed to operate in DC, the District of Columbia, what I'm going to do is I'm going to go select that state of the District of Columbia, and then I'm going to put the enrollment for DC, Maryland, and Virginia. So I'm only going to have one state listed, but the enrollment for all three states will be listed under that one state that I listed. Now, for the number of members in your states, it's going to be as of December 31st of the measurement year. So December 31st is your cutoff as to when you're looking at your members. It's enrollment as of that date. And the same goes for those accredited plans, enrollment as of December 31st. Now, if you're accredited and you're entering your states, you're only going to enter the enrollment for the states that you are accredited in. You might be licensed to operate in 50 states, but you're only accredited in 2 states. So that means you will enter the enrollment for those 2 states only. And you're only going to list those 2 states. Now, as far as your submission goes for that accredited submission, you have a submission that's just used for accreditation, those states would be the only states represented in the data that you submit as well. Now, if you have questions on this, please do not hesitate to contact your HEDIS account manager. We'll be happy to help you with that. Also, for those that have shared organizations, you might have 2 or 3 organizations that use just the one submission. But when you're filling out your HOQ, each of those organizations are listed separately, and you're going to do your enrollment for each individual organization. So they shouldn't be the same since each organization has its own members. And then if it's accredited, of course, it's only going to be those accredited states listed in enrollment numbers for those. If you have questions also on which states you're accredited under, we do suggest that you start with your own organization and those that work with accreditation. And of course, if you need additional help, your account manager is always willing and available to help. Last but not least, marketplace operational terminology. So in the system, the snapshot shows you the new things that we put in just to clarify what we mean when we say, has reporting unit been operational for 3 years, 2017, 2018, 2019, and what we mean by that. And so as you can see here, it says This field asks whether the reporting unit has been operational for the last 3 years. It does not ask whether the reporting unit has reported or submitted QRS data. It's asking if it's been operational. So, and then also we have here some information about what we mean by operational versus not operational versus discontinued. So we just needed some clarification for that. If you have any further questions in regards to that, please, before you start trying to complete things in the HOQ, contact your NCQA account manager and we can help you work through this. Okay, just a little review of our CAPS and QHP survey sample frame process. This process starts with the plan sending their survey sample frame to the auditor. The auditor then validates that and applies their lock. Once that's done, the plan would then send that auditor lock survey sample frame to the vendor. When the HOQ opens, the plan can then go in, request their submissions, and then they can give access to their auditor, who will then go in and enter their survey sample frame results. Once that's done, and anytime before or on the HOQ deadline, the plan can go in and mark their HOQs final. All right, we have here a couple of points we wanted to bring out about the CAPS scoring and the QHP enrollment survey components. For Medicaid, the organizations are given the option to choose which CAPS component they want to use for scoring and to be used in the NCQA reporting programs. This will be on the products tab in the new HOQ. And of course, when we go through the demonstration, I'll show you what that looks like. Also, with that CAPS scoring component, once it's been selected and your HOQ has been marked final, you will not be allowed to make any changes to that selection. So please, before you mark final, double check, triple check to make sure that this is the scoring component that your organization wants to use. For the Marketplace QHP submissions, the QHP enrollee survey section is actually defaulted, so you don't have to make any selections or changes to that section. You do, however, have to get your auditor's approval, so you have to give them access to that submission. They have to do their approval before you can mark final. As we did last year, we had noticed areas where there were problems or questions. So we're continuing with that this year. And so what we found from last year is that there were some questions in regards to submission types versus public reporting, and also sample frame approval versus HOQ deadline. So we'll just go over that real quickly. Okay, so our questionable areas, the submission types versus publicly reporting. We want to bring out that for public reporting, the only submissions that you can publicly report would be the NCQA programs submission types. If you chose state or other, those are not submissions that we can have you publicly report. So once you get to IDSS and you get to submissions that were listed for the state or listed as other, once you get to that attestation, you can't select to publicly report that. We can't use those. So it would have to be an NCQA programs submission that's used. Now, as we show here, we use NCQA programs for HPR accreditation and for Quality Compass. And if you publicly report, of course, your plan name will be listed and the data will show. For those plans that are accredited, even if you choose not to publicly report, since you're accredited, the accredited measures will be forced, and those will be used for Quality Compass as well. For those that were state submissions, we only use those for state and county. Those aren't included. Others, basically for your internal use or federal programs, those type of things. Those selections, as I said, will not be used to be publicly reported. And of course, it's up to each plan to decide whether or not they want to be publicly reported. But in general, it's an NCQA program submission that has no special project and no special area. So it's what we call a none submission with the NCQA programs. If you have any questions or any confusion about that, please, before you set things up in the HOQ, contact your HEDIS account manager. We'll be happy to help you with that and walk through that with you. All right, our next section is our sample frame approval versus the HOQ deadline. They are not one and the same. Your sample frames have to be approved by January 31st, which means your auditor is going to go in and they're going to approve that sample frame. That does not close your HOQ. And it does not stop you from making changes. So as long as it's done by the 31st, that's fine. If changes have to be made after that to the sample frame approval or anything that you have to do regarding that sample frame approval, your auditor can go in and remove the plan lock. Once that lock is removed, you can make your changes, and then they will go in and reapply that plan lock. And then from any time from that until February the 15th, you can go in, finish up the rest of the HOQ, and mark it final. But once again, January 31st is just when the sample frame has to be approved, not when the HOQ has to be marked final. Any confusion about that? Once again, please contact your assigned NCQA HEDIS account manager. Okay, we are finally at the demonstration portion. What we have here is the NCQA applications online page. In the kickoff email that you receive, there's a link to take you to this page. If you don't have that, don't worry. If you go to your My NCQA portal, log in there, there is a link for NCQA applications there that will bring you right to this page. So we're going to get started by going up here to our sign in section link, I guess. We click that and that brings us to our sign in or login page. We do want to remind you that your login is always going to be, or user ID is always going to be your email address. And the password would be the same password you have for myncqa.org portal. So if you remember that, you're great. If you don't remember that password, or if you are a new user, you're simply just going to go down here and click on Forgot Password. That's going to bring up the password assistance box, and all you have to do is enter your email address and then prove you're not a robot and click continue. Once you do that, the system is going to send you an email so that you can reset the password. Now, if you don't receive an email in about 15 minutes or so, a couple things to keep in mind. Primary contacts are the only ones that are initially given admin access or rights to the system. So if you are a primary contact and cannot gain access, you're going to need to contact your NCQA account manager. We can help you get in. Now, if you are not the primary HEDIS contact, you will need to work with whoever is that assigned primary contact within your organization so that they can give you rights to the plans that you need access to. But we're going to go ahead and get started and click our login button here. Okay, so with that, we've gotten to our page here, and there's quite a few things on this page. First thing we want to point out is up at the top. As you can see, there are a couple of things. You won't see administrator. That's the magic of my NCQA login, but you will see applications, view agreements, and the log out link there. At any time that you want to get back to this page, and it's going to be on every page you go to, you'll have this link here for applications and NCQA. Applications will bring you, as I said, right back here. We also have a couple of other things. If we scroll down, you see the training video for last year. Whenever you get to see this video, it will be updated and the video that you're viewing will be listed here. Below that, you can see a section that says don't see what you need. A couple of boxes. I don't see my organization. I have another question. This section is for accreditation. So So basically, if you're working with HOQ, you're not going to use this section. You would actually go in through your application, and there are links within that page that will lead you directly to your account manager if you have a question or if you need your organizations added. Just a reminder, this page is currently used for both the accreditation applications and HOQ. So if your organization is going through the accreditation process and you have access to that, in the section or step 2, you'll see the applications listed there, as well as your HOQ applications. But of course, we're talking about HOQ. So we're going to get started looking into that. Another thing I want to point out, forgot about, the roles and permissions for HOQ will be the same as they were for your organization last year. It's the responsibility of the primary contact uh, to grant access and set things up. So if anybody needs to be removed or added, the primary contact is responsible for that and to set things up. If at any time they need any help, they can contact their NCQA account manager and we can help them with that. Okay, so step 1, select an organization. There are a couple things on this section that you want to take a look at. If you have multiple organizations, they're all going to be listed here, of course, and you can decide how many you want to see at a time. I only have 5, so it's only going to show 5, but you can do 10, 25, 50, up to 100 organizations at a time. You can also search for your organization by name or by org ID number, and you would just type in whatever part of the name, and I did that wrong. Do IDSS, and that org comes up. You can also sort by org ID number or by organization name or your actual location and applications. So for applications, it's going to show you for the HOQ, if it's in process, if it's not, if it's marked final, all of that will list here. And if you have different states or where your organizations are located, you can sort by that as well. We do want to mention that if you do not see your organization listed and you're the primary HEDIS contact, or if you have a brand new organization that you want to add to the system, in both cases, you're going to need to contact your HEDIS account manager if you are the primary HEDIS contact. If you are not the primary, you need to contact your primary and let them know that you're missing organization so they can give you access to that. Um, and other than that, that's the end of this little section. And we're going to move on to our next section, which is our step 2. Okay, step 2, review and edit your applications. We do want to know, just as we said previously, if your organization is undergoing anything in the accred process, you will see those accreditation applications, if you have access to those or rights to those, listed here along with your HOQ. We also want to point in the step 2 section, we have a link that will take you to the complete user's guide for HOQ. Um, and but we want to actually show you a couple of shortcuts in the tool. So we'll show you that once we go into the HOQ. Here, what you see is the HOQ itself, and it has the status, and also has the last date modified listed. Now, when you select your organizations, what you'll see is the name also changes up at the top, and then your status will change. So if I go to the next org here, you can see that that hasn't started yet. And when you first log in, this is what you'll see. It'll say not started. So we're going to select our organization by highlighting it, and then we're just going to click on continue. This is going to take us to the HOQ for this organization. As you can see, the name up at the top. But before we get into the actual steps within the HOQ, we just want to point out our help section over here. This tab will appear on each one of the tabs that we have, all 7. And when you click on the help section, what happens is it automatically goes to the instructions for the section that you're currently in. So instead of having to kind of figure out what part of the HOQ you want to go to, you click on the help button and it takes you directly to the section that you're working in. Also, we want to go to the bottom of the page and check out the menu that will appear at the bottom of all of the pages once you get into the HOQ tool. If you are an admin user, you will see the link for the HOQ Users Management. Everyone will also see the Ask a Question, which if you click on that link, it opens up that box. You can submit your question and it will go directly to your account manager. So close that. We also have the FAQs. And then there's a blog, terms of use, which we saw when we came into the tool, and about NCQA, and then a link to take you to our home web page. So we're going to take a look at the HOQ management tool, which, as we said, will only be available to the org admin users. Generally, this is your primary HEDIS contact. Once you click on that link, it says, do you want to leave? And of course we do, because we want to take a look at our users. Once we are there, what we see is a list of all users that are assigned to the organizations that you are the admin user for. All the users from last year have not been removed from the system, so we do recommend that the primary look over the list of users and make sure they all should have access to the organization. With our update, we've made it so that there is only one way to update and manage your users for all types of users, be it auditor or a regular user within your organization. And so we'll just briefly go through how to add a user. Then, but before we start that, I'm sorry. The new tools that we have, if you have numerous users, you can select how many users you want to see at once, from 10 to 100. You can also now search for a user using an email address. So we can pull up my email addresses, they're listed there. Now, to add a new user, we simply would just go and click on the button, Add New User. And what happens is it's asking for their email address. Email address, of course, is going to be their user ID. Before you add a new user, we do want to point out that you should search for them in the system to make sure they're not there. Secondly, every user that is in the HOQ, in order to access the HOQ, has to have an account set up in the My NCQA portal. In order to access a tool, you have to have an account under My NCQA. So you might want to check with the users to make sure that they're using, if they already have an account, that they are using the same email address that you'll be putting into the system, because if they don't match up, they won't have access. So we're just going to add a new user. Once you do that, that's the email address. You can start selecting your user role. Now, users should not have dual roles, so they can't be an auditor and a user for an organization. So what we've done is, once you select the type of user you want them to be, you hit add. You'll see for the other type of role, that organization will disappear. So you can select one by one, you can shift and highlight, add them all, and once you do that, you just save changes. And that is all there is to giving someone access to your orgs. Now, if you want to make some changes, as you can see, the person was added to my list now. And I didn't point out that you can actually sort in alphabetical order for the email addresses to make things easier for you as well. But for the user I just added, if I wanted to make some changes, I just simply click on Modify. Once I do that, their assignments come down, And I can say I didn't mean to set them up as a user. They're an auditor. So what I can do is I can remove them one by one, or I can highlight them all with the shift key to remove them, and then go down and give them access. They're my auditor, so I'm going to add that. Save changes. And they've been updated. Now, let's say that I have someone that no longer works for the company, or they moved on, or whatever. I want to remove them, their access to my organization. So to do that, I would simply just click on the arrow, remove all HOQ roles. And it says this will remove the roles from the user. Are you sure you want to proceed? This can't be undone. And the thing is, you can say yes. It will not remove the user from your organization listing right away. And it does not remove them from our system, but it does take away their access to all of your organizations. It goes back to blank. Okay. And that is the simplicity of our new users management section. Now, to get back to the organization HOQ that you were just in, if that's what you want to do, you just simply click your back arrow in your browser, and that's going to take you right back to your HOQ for that organization. So now let's go through our step one. Step one, organization identification. So we have a couple of new questions that we took a look at in our slide presentation, and they're listed right here. When you first come in, they'll probably be red because they haven't been answered yet, and you have to answer these questions that is required. And there are questions about your legal entity, your name. Has that legal entity changed or the name changed? If you say that they're not the same, it'll have you contact us, your account manager, so we can make sure we get things corrected before you go any further. If they're the same, you would say same. And then we have a question about your financial status for your organization. Since the last submission, has this organization filed for bankruptcy or liquidation, or has it been placed under supervision or receivership? If the answer to that question is yes, and you are an accredited organization, you would have to click this link to send an email, because that is a reportable event, and as an accredited organization you do have to report those events to us. But for the sake of this review, we're just going to say no, and we're going to move on. Now, the other thing, and new thing that we want to point out, that for each of your HOQs, your assigned NCQA HEDIS account manager's name will be listed here, so that you have no question as to who you need to contact should you have any questions or need anything. Now, you can make any type of updates that need to be made within the org. And we make that update, and as you can see, it does our billing address. If it's supposed to be different, you can just uncheck that box and put the correct one in. But we're just gonna check everything, make sure everything's okay, and then we would save changes. But I forgot to point out your org ID name. You can't make changes to it. Your org ID is listed, as well as at the top of the page. So I just wanted to point those out. If you have any questions about what we mean by certain things, what you'll see are these little question marks here. And if you just hover over them, they will tell you what we mean for these sections. So we've updated everything. Things are good. So we're going to change our type. Organization type, it is actually an MCO. And now we're going to save our changes. As you can see, the green section comes up to let you know that your information has been saved. So you're actually finished with this page and you can move on to the next. You can do that two ways, clicking at the tab at the top or at the arrow. So we're going to go ahead and we'll just click our arrow and go to our next section, which is roles and contacts. We'll start with our active contacts. What we can see is a list of everyone that we've added to the system and whether or not they have a role, how many roles they have assigned to them will be listed here. If you want to update a person's information, someone got married, or if their phone number changed, email changed, whatever, you would simply just go and click on edit. Once you do that, it brings up that person's information. And what we see is we want to use the billing address in the system to update that. And their titles listed there, credentials, they're an MD, so we want to put that in as well. We selected that, that's done. Their phone number, if you have an extension for them, put that in if there's an extension. Anything else that needs to be updated, you update here and you just save and close. That person's information's been updated. If you want to inactivate someone, they're no longer with the organization, you just simply just click on the arrow and you're going to click on inactivate. Wants to make sure that you want to do that, you say yes. And what you can see is that person has been moved down to the bottom. Now, if you need to activate them again, you would just simply click on the activate and it would move them back up to the top. And there they are. So then we're going to edit and give them a real name. Well, we can't give them a real name. The name stays the same. The first name, regardless of whatever it is, it's going to be in the system. The only thing that can change, because this is that person's record, the only thing that can change is the last name, and that's just in case they were married or divorced or whatever, that last name change can be updated. So we're going to discard, and we want to remove this person. Yes. So they're inactive. Now, basically, if you need to add a new person, you just simply click on New Contact, and you're going to put in new information. And their title, and as you can see, things that are required have a little star beside them. If I was to try to not fill that out, you would get the instant error message and know that you need to complete that. So title is and their email address. And their address. Now, if this person is at a different address besides the organization address, you would simply just type it in here, or you can just click on Use Organization Billing Address, and it'll automatically update that. Phone number is required. And then we can add an extension. Once everything is the way it needs to be, we save and close. And as you can see, the person is listed here, but they don't have any roles assigned. Now, to assign roles, it's as simple as going to that role and getting to the drop down box, and everyone that's active will appear in this box. You simply just click on their name and they have been updated. You need to add someone else. You can go through and select and change all of your roles just by going through the drop downs. And that's all there is to updating, which is helpful for those that have same people in different roles. You don't have to change each and every one. You just go through and do your drop downs. And you just simply click on Save Changes. That's been updated. And once we're finished with this section, which we are, we just simply can go to the next section, which is tab 3 for our products. Okay, step 3, tab 3, products. So product lines are displayed here, and these are the current product lines that we have listed for your organization with enrollment. If you have any new products, you're going to have to add that here, and we'll show you how to do that. You will still need to update each product line's enrollment information as of 12/31/2018, since that's our measurement year. If you're submitting data on a subset of a population of any of the product lines, you would actually combine that product's enrollment here. You show that you have separate subsets when you're requesting your submissions, which we will show you on the next slide. But let's get started. We're going to take a look at Medicaid, because this is the area where you're going to deal with your CAHPS scoring component. So let's click on the Medicaid HMO we have. When we click this button, what we see here is our model type and our profit status. So if we know that, we're going to select our model type and profit status. And then, as you can see, the next section here, it says CAHPS component to be scored. So this is where we're going to select that. The commercial can only be adult CAHPS. Medicare, we don't collect CAHPS. But for Medicaid, as you click your drop down here, you'll see that we have adult, child with CCC. So you're going to have one of these used to be scored. And so we'll say adult CAHPS here. And then you have the note here: once an organization is marked final, no changes can be made to your Medicaid CAHPS scoring selection. And then the other note: all Medicaid plans that submit CAHPS will be required to select which CAHPS survey NCQA should use to their evaluation and reporting products. If you have questions in regards to this, we have a link here that will open up a page that will discuss that information. Once again, if you have any questions, need further assistance with that, please contact your NCQA HEDIS account manager and we can help you with that. But the most important thing is make sure that the CAHPS component that you chose to be scored is the one that you want, because once you have marked final, we can make no changes. So after February the 15th, down the line, somewhere in March, your organization goes, no, we don't want to do adult, we want to do child. It's too late. We can't make any changes. So please triple check on what you want scored. Okay, now moving down to our coverage areas. This is where we were talking about the new section, as you can see listed here, where it shows the differences between accredited versus non-accredited plans and how you're to complete your enrollment for those products. So if your plan is not accredited, you're simply just going to pick the states that you're licensed to operate in. For this one, it's going to be Arkansas. We're going to say this is the one, but you might have other states that you have members in. Since you only have one state that you're licensed to operate in, you're going to select that one state, and then you would include the enrollment for the other state along with the one state that you are licensed to operate in. So if I do that, my numbers are going to change here, and I've updated that enrollment. Now, as you can see up here, that changes. Just in case you have more than one state, if you were to add another state, you could pick any other state. I'm just going to say Connecticut, and I had some members there and I'm licensed to operate in that state. I could add that And once I add that, my two states are listed, and as you can see, I have a combined total for the two states that I have listed. If I made a mistake, I can remove that, and it'll automatically update that section above. Now, if you have any market names that you want to use for your product, if it's 3 or 4 names, you can enter them all here, and I can say add, and I can continue, and I can add. If that was a mistake, or if you had market names already listed, you can simply just remove, and that's done. Once you're done with that, this product, which is Medicaid, my Medicaid HMO, you save and close. Once you save and close, system's a little slow. So we saved and closed. It gave us a little green light to say it was okay. And as we can look here, our Medicaid information has been updated. Now, we're going to move on down to say we had a product that we wanted to add. We're going to click on New Product, select our product line, select PPO and EPO were the only commercial products we didn't select, so of course it's only going to show the ones that are not already listed. Our model type, profit status, and as you can see, there's a note: commercial submissions with certain criteria are subject to IDSS users fee. If you have questions in regards to what those criteria are, you can click here, and it will tell you if you would be incurring a IDSS users fee. And basically, if you're not accredited, this is something you want to check. If it's an accredited submission, you don't have to worry about that. But once again, we have our information about accreditation. So let's say that this is an accredited submission, and it's not about my license to operate. It's about what states I am accredited in. And those are going to be the only states that I list and the only enrollment that I update. So we're going to go and say that I'm in Arizona and I have members. It's a little weird the way it does this. You can't add it until you click on that state again. And then when you hit add, it'll pop up. And let's say I am accredited in Arizona only. I have other members that are a part of this commercial PPO, but Arizona is the only state that I have accredited by NCQA. So literally the only thing that NCQA is going to report on and is concerned about are the population that I have accredited. So I'm only going to list my Arizona members, and then the submission that I submit in IDSS is also going to be only for my Arizona members, and I'll show you how that looks in the submission list page to set that up. But for now, we don't have any market names. We're just going to save and close. As you can see, that was updated and listed now here below. Now, Marketplace is a little different. We have some things there, some new stuff. So let's click on that. Well, the new stuff's not here. It's actually on the submission page, and we'll show you that later. For Marketplace, if I have a Marketplace submission, if I know any of this, I can select it. Next question here: to the best of my knowledge, I can demonstrate my reporting unit has an enrollment status greater than 500 as of July the 1st, 2018. The answer is yes. If your answer is no, you're going to be told to contact NCQA by clicking Ask a Question at the bottom of the page. And it's not at the bottom of this page, but at the bottom of, I'll show you. Let's close this out. Discard. The ask a question down here. You would click that. That email is going to be sent to your account manager and we can handle it from there. But let's just say things are good. My answer is yes. The next question is, had an enrollment status greater than 500 as of January 1st, 2019? If that answer is yes, that's yes. If you say no, it's going to tell you once again, click on ask a question and get in touch with your HEDIS account manager. But we're going to say yes. And then we have notes. Marketplace QHP enrollee survey are collected by CMS, not NCQA. So there's nothing to fill out about the survey. Also, all the marketplace submissions are CMS ratings eligible. If you have questions about that, you can click the link. It will open up another tab for you so you can read the latest information. I do believe that information is as of 2010. And then there's information about SHOP, SHOP, and individual market enrollees from the same product type should be combined to determine the total count of reporting unit enrollment. If you do not know what SHOP is, don't worry about it. You would know what it is. If you have no idea what that is, just go ahead and do your enrollment as you normally would. Once again, if it's accredited, you're only going to put the accredited states. If it's not accredited, you're going by the states that you're licensed to operate in, and you would roll up all the members from the other states and put those in. But accredited, you're only listing the accredited state and the accredited enrollment numbers. So here we're going to update and say we added some folks. That's done. That's updated. I can come down and save and close. That's updated. Now, for any reason, if you had a plan that you're no longer offering and you want to get rid of it, say, I do PPO now, I don't have POS, you click on Edit, and at the top of the page, you click on Discontinue. Discontinuing commercial POS means that the submission cannot be requested for this product. That's fine. I save and close. And what you see is it's still listed, but under discontinued, it says yes. If I did this by accident, I can simply, or in error, I simply click on Edit, uncheck that discontinue box, update my information, and then we're done. That's that. I've set that up, save and close, and my updates are done. Let's take a look at Medicare. We have a couple of scenarios here. So I'm going to click on my edit. Now Medicare is one of those that you have subsets that you're reporting on. Like I said, the subsets are shown in the submissions page. Here, it's everybody that is Medicare is going to make up your enrollment. Unless it's accredited. If it's accredited, it's still the states that you are accredited in, that you're going to list in the enrollment that you are listing. Now, let's say I'm updating this. I always just pick something. And my numbers are different now. Once I did that, it's updated. And as you can see, caps, we don't collect caps. CMS does. So there's nothing to fill out here. The difference here is you have a CMS contract number. If your contract number changes or you have another one that you're reporting on, you might have 3 contract numbers. You simply would just go and add the ones. Hit add. Hit add. So now all your contract numbers will be listed. And then when you go in to do your submissions, your contract numbers will be listed there for you to select and add to the submission request. If you had market names, you add them. If not, you just save and close. So as you can see, we've updated our products, and you have to update all of your products. Make sure you do that. And then you move on to the next section, which would be our submissions. Moving on to our next step, submissions, tab 4. Um, Listed here are the submissions that were requested last year, as well as any shared subs that were used last year. Now, if you are brand new and haven't reported data to NCQA as of last year, this page will be blank for you. Um, and we do have a couple of shortcuts on this page. You can select how many um, subs you want to see if you have multiples. If you want to sort through and scroll through, instead of scrolling through, you can do a sort on those areas that we can sort through. So sub ID, product line, reporting product, and requested. So if I put in marketplace, all the marketplace will come up. But if I just want to sort, I can sort by sub ID, product line, reporting product. And then this section here, requested, it will show us um, the submissions that have been requested this year. I'll say yes for those that have and no for those that have not. For those that say yes, if you scroll down under the 2019 requested HEDA submissions, those will be listed there. So let's get started with requesting a submission that we previously requested. So we're going to use the marketplace submission, and we're going to click on the blue arrow. Once we do that, it opens up and it gives us all this information. Check and make sure that that is correct. Once we do that, we will click on request submission. And from there, we bring up all the information that we cannot change. Like I said, if any of this information is to be changed, what you would need to do is create a new submission. But for this one, we're requesting this one. Everything's good. Our first question is first year reporting unit operational. And we can select the year that we did that. And then our new section or section that we upgraded or updated to show what we meant by operational. Has our reporting unit been operational for 3 years? If you hover over this, it'll tell you what we mean by that. And once you go through that, you can decide whether your answer is yes or no. And then here we have our marketplace terminologies and definitions. If you click that link, it's going to open that up and show you the definitions for operational, not operational, and discontinued. We also have some links listed to show the difference between discontinuation and uniform modification. But we're going to move on here. And as you can see, the audit required box is grayed out because all marketplace submissions are to be audited. And we will select our vendor here. From there, we will go down and we can see that our measure logic can be selected. If you use the NCQA certified measure vendor, you're going to be able to go in and select that vendor, put them in there. IDSS, yes, you do need an IDSS, so that is listed for you there as a yes, and you can't change that. As for the QHP enrollee survey, for that, the survey is required. You're going to put in your vendor if it's not already there. And then once you save this, you can let your vendor know that they can go in and they can approve your survey sample frame. So we're going to save this. And upon saving it, what we'll see is at this section, the marketplace is listed and it says yes. And if we scroll down, we'll see it listed here as well. So let's move on to
um, another previously requested sub. Let's move on to our Medicare submissions. They're a little different. With Medicare, as we said, in Medicare, you generally have subsets of populations that you're going to report, and that's going to be done by your CMS contract number. And as you can see here, last year we had 3 submissions with the same contract number, but we had an S&P, the PBP, and then the regular CMS submission, which includes everyone in um, under that contract H 1885. So basically, we're going to do it the same as we did the year before. Nothing changed, and we're going to request that submission. Put our audit firm in, measure logic, and our vendor. Hard coded in is that IDSS. And then for a regular CMS submission, that's where you would put your HOS survey information. So for the baseline, I'm going to say yes, vendor, and our follow up is a yes as well. Select our vendor. Save and close. And as you can see, that has dropped down to the bottom as well. And up at the top it says that it has been requested. I'll show the S&P as well. For this one, we just have to say who our audit firm is, and our method for collecting our measures, and our vendor. Of course, we need an IDSS, save and close. Now, when we started this, we added a new contract number. So at this point, to add that new contract number, I'm going to need to create a new submission. So I would go here to the New Submissions button, click that. My product line is Medicare. Reporting product is still with HMO. Submission type, I'm going to say it's a CMS submission type. And my contract number, H. I don't remember what I put, but you should remember what you put. Put that contract number there. And we're going to do our audit firm, survey vendor, and our baseline. This is new, so I don't have a follow-up. Save and close. Now if we scroll down to the bottom, we can see that my new H contract number is listed here, and my sub ID will be assigned in April once the new sub IDs are announced. Now let's do a Medicaid since that LTSS is brand new. All of the LTSS submissions, as we stated, will be new submissions since they will only contain the LTSS measures. So you're going to click on New Submission. Your product line is Medicaid. You select your reporting product. You don't have to select submission type. You can actually just go straight to Special Project and look for the LTSS, which is here. Once I do that, automatically the submission type changed to Other. No audit required, so I don't have to select a firm. That's all grayed out. I do need to put in my certified measure vendor. And I'm going to be submitting by way of IDSS. So I'm going to say yes, and then save and close. Now, as you'll see at the bottom here, sub ID to be assigned, LTSS, and then we have the no special area listed. Okay, so we've requested all of our older submissions, and we've added our LTSS. Let's say, just because, just to show you, let's do one more new submission. And we're going to make this one commercial. That's not commercial. We're going to make that commercial. And for commercial, we have a couple of selections we can do. And this one is for our state. And so for our state, we have a special area. And I think our state that we choose was Arizona or Arkansas. So we'll do Arizona. And it was audited. Demo. Oh, sorry. It's not an OPM submission. If you do have OPM submissions, you would say yes to this and then put in your FEEP codes here. If you're unaware of what an OPM submission is, don't worry about it. You would know if that's what you had to do, but it's not an OPM submission. We do need IDSS, a tool, and we are not doing caps for this one. And we're going to say save and close. And as we can see, it's been added to the bottom and it's listed there. What I wanted to show you is just in case you did something by mistake, if it was a new submission and you wanted to remove it, you would go down to under where it is requested, click on the blue arrow, and if you needed to make some changes, you could click on edit and change anything here. If changes need to be made to anything in the grayed out sections, you will need to delete the submission and start over. So what I'm going to do is cancel and close. I'm going to delete the submission, and to do that I just simply click delete and say delete again. As you can see, it's been removed. It's no longer listed. If it was for a sub that was previously requested, and all I would have to do is, once again, click the blue arrow, click delete submission, say yes again, and that submission is no longer listed here. But if I did need to put that back in, since it was requested last year, I can go back up, select it again, and request submission, fill out my information, and it will go back under our requested submissions. So once all your submissions have been requested and your auditor has approved those for you, you're going to move over to your next tab, which is the review section. So let's do that.
Okay, so we are moving on to our next step, which is review. And we're just going to click the review tab up top, tab 5. And what you see is the review of the application or your HOQ. On the left, you see what NCQA currently has for you. And on the right, under application information, we see what you made changes to. Now, each section can actually be collapsed and it'll take you to the next section, so you can go section by section, opening or collapsing it. If you want a report of everything that's listed on your application information side, you can click on the PDF version, and that's going to open up a new window and bring up a report for you with all the information that's listed in your HOQ, all the information about what this report is, and everything that's in the system as it is in that report. Now, as you make updates, of course, this report will update as you go through. But we're going to close this window out, go back. Now, if you only want to see things that were changed, you can just show only the fields that have changed, and then you'll see what they changed to listed here. If there is anything new, new contact or a new product line,
You won't have anything over on the current information because it's new, but it will show you that it's new, but with the green new listing beside it. Now, going back to showing all fields, just wanted to show if there's some kind of way that you went through without updating first tier era. It's going to show in red. And to make changes to anything that you see, you just simply click on the edit box here, and it's going to take you to the page that update needs to happen on, and you can make your changes there. And so we're going to put in the website. Oops, not an address. Org. All right, and then now that we have a website, we can save our changes. That's been updated, and if we go back to review, we can see now that there's been a change in what it was changed from and to, and all that information will be listed there for you. Um, Anything new, as I said, would be listed on the side, and you can make changes to those as well. If you need to make changes, you would actually have to go back to that section to change those things. So once you review everything and you're satisfied with the way things look for your update, you can now go on to your next steps, and that's going to be our documentation and our finish page tabs. Okay, so we've moved on to our next tab, which is documents or upload and download documents. This page simply, there's no upload for HOQ, no need to do any uploads there. But for downloads, what we have is a list of the correspondence that's been sent out for HOQ this season. So you have the CAPS scoring component information, as well as the kickoff letter that was sent out, and the information on the IDSS user fee. Um, so if you have any questions, you lost your documents or whatever, you can always come to this section and get that information. So we're going to move right on to our last section, which is our 7th tab, and it's our finalization tab. And once we click it, it's going to do our final validation on what we've done. So works the same as it did in prior years. Red means that you have issues and errors that have to be corrected before you can go any further. The yellow is basically a warning. Warnings don't prevent you from finalizing, but we do need you to review that to make sure that's what you want to send to NCQA. Now, when it comes to, as you can see down here under the helpful reminders in yellow, it shows that our products, our enrollment for certain states haven't been updated. Now, just want to note to you or make you aware that yes, the system will allow you to finalize, but what's going to happen is you're going to receive a call from your NCQA HEDIS account manager letting you know that your submission has been unlocked and we need you to update the information, that enrollment information, and resubmit it to us. So in order to avoid that scenario, you need to go back at this point and update your products. And when you go into the link here, it just takes you back to the page that you need to update. So you would go back and update that information. And once you do that, you click on tab 7 again, and it'll do the validations for you again. And if I had updated this, these would go away. And there's some other information about enrollment that I need to take care of. But let's go up to the errors. So we have an error in our submission, and it's unaudited. So the caps only that I did, and it says that it should be not required. but that's not the case. The submission itself needs to be audited. So I would not go back to products here, but I would make a change in the submission. So if I go back to my submission page and go to that submission, I would change that to audit it and put in what my auditor group is to get that error to go away. And then under submissions, as you can see, it's saying that I haven't had my survey sample updated or validated by my auditor. So at this point, I would have to contact my auditor and let them know that they need to go in and do their validations for me so I can get rid of these error messages and move on. So what I'm going to do is contact my auditor and have them do that, and we'll rerun this. Let's do that now. Okay, now that I've contacted my auditor, had them do their updates, I'm going to click on my Finish tab again so those validations can be rerun. And now I don't have those errors, but I have one more that's talking about my Medicaid POS product. It says that I've selected adult caps to be scored, but I haven't requested the submission to include that for the POS adults cap. So now I have to go back to my submission and under my Medicaid POS product and request the submission for that. So let's go back and do that. Since that was the new submission, I had deleted by accident, so I need to request that. So I'm going to go back, click on new submissions, and do my Medicaid POS. Didn't have a special area or anything. I do have an auditor. Need an IDSS. And adult caps was selected, so I have to say yes. And pick my vendor. And once I do this, I'm going to have to contact my vendor because if I run my validations again, it's going to give me an error message because it hasn't been validated yet. So I've requested it, but oops, I forgot my submission type. And this, of course, is NCQA programs. And I have to say no to the child caps. Now I can save and close. And as we can see, let's see, we'll collapse this. We have that sub ID to be assigned, which will be assigned to us in April. So I'm going to contact my auditor and have them do their approval again just for this submission, and then I can hit my tab 7 again. Okay, my auditor let me know that they've done their thing, so I'm going to click on this Finish tab again, and it's going to run the validations, and as you can see, I have no more errors. Now, as we stated before, I have warnings, and there are warnings here that I need to take care of in order not to get that call from my NCQA account manager. But just for this training here, we're just going to go ahead and go down to the bottom that says that we can reach the finish line. Our application appears to be complete and valid. And so we would just click here to submit the application. Once we do that, we'll get an email and we will be able to go back, and if we go back, we'll be able to run the report if we haven't run the report already, but we won't be able to make any changes to the system. We get our thank you, and you can get your report right here to get the PDF version of the application. And so that's actually the end of the complete review of the new HOQ tool.
Well, we've finally come to the end of our HOQ training session. We want to thank you for taking the time out to view the video, and we hope that you did find it helpful in some ways. As always, if you have any questions, please do not hesitate to reach out to your assigned NCQA HEDIS account manager. You can go through the My NCQA portal as well as send us an email or give us a call. We are here to help you through this process. So here's to an error-free HOQ submission and the start of a happy HEDIS season.